Most people wait until something breaks before they decide to take care of things. And in the chiropractic world, we hear this a lot. People will say, yeah, I heard when you start going to the chiropractor, you have to go forever. And we wanted to speak to that a little bit more. We want to talk a little bit about wellness and maintenance of the spine as it pertains to chiropractic care. But first, realize that we don't have to do anything forever, anything, right? But if something is that incredibly beneficial for your health, like chiropractic is, the real question is, why wouldn't you want to do it forever? Like Dr. Elledge here, he likes to eat healthy. He likes to work out. When do you get to quit doing those things?
Never.
Never, right? We continue doing these things because of how good they are for the body. Look at a lot of medications, people on certain heart medications, thyroid medication, diabetic medication. When do they get to quit those treatments? When do we get to quit mowing the lawn? When do we get to quit brushing our teeth? When do we get to quit clipping our fingernails? When do we get to quit putting gas in the car, right? And as we were talking more about this, we'll talk about these things with patients and they'll kind of chuckle a little bit. But when it comes to chiropractic, and many of our patients, to their credit, they fully understand this, but there are some, and there's people out there that they can never understand why it would benefit us to continue to see a chiropractor regularly. And I really think that stems from there's a disconnect between people understanding what it is that truly got them here. A lot of people will think, well, if I didn't slip and fall on my head last week, or I didn't get T-boned on the road, then I don't need to be seeing a chiropractor. And so there's so many things that we do on a day-to-day basis, a week-to-week basis, that can necessitate regular chiropractic care. In fact, Doc has a line that I love that you say, and people will ask this all the time. Hey, what's caused this, or what's causing this? And do you remember the line that
Absolutely. Yeah. What causes this, or what do you think caused this? It can happen a million different ways, and there's one way to fix it. I mean, that's as simply as we can put it, because we could go down this rabbit hole of what may have caused it, and it's truly just us guessing. We don't really like to guess, but if we know what the problem is, and once again, we do know what the problem is because we take X-rays of the spine.
Yes.
And for those of you, once again, we have patients come in all the time. They're in their 40s, their 50s. And I say, when's the last time you had your spine imaged? And they'll say, I don't think I've ever had my spine imaged, which is the wildest thing to me, because your spine is the most important part of the human body. It integrates all of your other systems, communicates from the brain to all of your other systems. And we've never had a picture taken of your neck, your thoracic spine, your lumbar spine, your pelvis. It truly is. It's something that's so common.
Yeah.
I mean, we go to the dentist, we have X-rays taken of our teeth all the time. And we may see someone in their mid, late 40s, 50s that have never had images of their spine taken, which to me obviously seems very, very important.
And the dentist is a great example, because people will understand, hey, I'm eating, I'm chewing, I'm doing these things daily. Of course, I'm going to brush my teeth every single day of my life. I'm going to brush my teeth forever. And we can't fit a million things on these kind of sheets, but we can fit 72 ways of the spine, and as far as how the spine can become misaligned, 72 ways the spine has stress and strain on it on a day-to-day, probably week-to-week and month-to-month, year-to-year basis. I just want to read a few of these just so to get you guys' mind kind of thinking about these, because I look at this and I see myself in almost every one of these. Sitting at a desk for long hours, picking up small children, lifting heavy weights with poor form, slips and falls on the ice, falling from a ladder, tripping, natural disc dehydration with age, chronic stress causing muscle tension, car crashes, whiplash, bumpy roads, video gaming, carrying a laptop bag on one shoulder. We could go on and on and on. And like Dr. Elledge alluded to, there's a million different things out there that can be deleterious and cause negative stress and strain on the spine, all the way down to the level of the joint, not just soft tissue, but down to the joint level, which is critical as it pertains to chiropractic care. And he's going to talk about that here in just a second. But we wanted to share a couple of these things just so you guys can start to realize that there doesn't have to be an injury or an accident for someone to benefit from regular chiropractic care.
Yeah, so I mean, and that's too, when we hear patients say, I stretch all the time, I mobilize all the time, I'm seeing my physical therapist all the time, which we're huge advocates of physical therapy.
Absolutely.
I mean, strengthening and stretching the soft tissue of the body is integral to obviously moving correctly and having stability. Well, what separates chiropractic care is we're getting down to the joint level, right? I mean, we have an unbelievable amount of joints in the spine, down from your sacrum all the way up to your skull. And all of those joints are really unique with the way that they move the human body. They all have a really certain responsibility. How do we get all of these little bitty delicate motions with our neck? All of these are really unique joints. And that's what separates chiropractic care from treating the soft tissue of the spine, the intrinsic muscles of the spine, or the extrinsic muscles. The intrinsic ones are the ones that relate directly to the spine and move the spine. And then you have 30 plus groups that are extrinsic that relate to the spine and move the scapula, but that moves the spine, or it may move the hip and that moves the spine. But once again, how do we get down to the joint level in the spine? And that's where regular chiropractic care is so unbelievably important, because if we keep those joints moving, then the soft tissue has the ability to stay really liberal and to support us and to stay stable.
And just to give the viewers kind of an idea, what have we seen as far as patients, or what could their life look like if they were under chiropractic care regularly throughout the decades versus not doing that?
Yeah. So we see an unbelievable amount of degenerative cases, right? Degenerative joint disease is one of the most common things that anyone over the age of 40 is going to suffer from. So what do we do in order to combat that? We get those joints moving really regularly. And the spinal biomechanics, or now they're using different terms like arthrokinetics, arthrobiomechanics, and those are those facet joints, those joints in the spine that are unique, that have to be continually mobilized by chiropractic care, through chiropractic care. And that's where maintenance care is so unbelievably important. Well, I came to the chiropractor, I got well, I'm moving really well, I'm doing the things in life that I want to do, I'm living a pain-free lifestyle. How do I continue to do that? By continuing to keep the joints and the spine moving really, really well, so your body feels like it can move without it getting tighter and tighter and tighter. Think about it this way. A loose muscle is a strong muscle. A loose ligament is a strong ligament. A tight ligament or tight muscle is a weak one. And that's what invites that instability. Whenever patients come in and they say, hey, I felt fine on Tuesday, I did something on Thursday, I bent over and lifted my child on Friday, and then I threw my back out. That is not how that happens. What happens is it's the instability or the weakness that leads up to that activity that allows your body to injure itself. And that's why ongoing chiropractic care is something that chiropractors recommend all the time. And it's something that chiropractors do themselves unbelievably regularly, just because we see the benefit of these patients that stop getting adjusted for months or years. And then all of a sudden, hey doc, I'm back. I don't know what I did, but I'm back in the exact same situation that I was in when I first started seeing you. Or even worse, a situation that's progressed and gotten worse and maybe more severe.
In closing, think about it this way. Let's say you came in with an injury. We do 12, 24, 36, 50 adjustments into someone's spine. And we take them from what we would call the pain zone, symptom zone. We work them up to a point where they're really close to that optimal health line. A lot of these patients understand at that point how critical it is to continue to maintain that high level of health. But there are some in every office, okay, and we've probably done this in other areas of life too, that you start to think, well, I think I'm good now. And then we'll see, 30, 60, 90 days, the patient comes back in all the way back down where they started. So now we've got to revamp and redo and recreate this optimal health status all over again. Whereas if the patient would have been being seen, say, every 2, 3, 4 weeks, they could have had 2, 3, 4 adjustments over the course of those 90 days and kept it shaped up. It's so much more efficient time-wise, so much more efficient financially as well.
And here's why. It's because the things that we do in an active, they're called activities of daily living. We set for over 7 to 8 hours every single day. That doesn't include the time that we're in bed. So 2/3 of our life, we're stationary. And that's not what the human body was designed for. We're designed for motion. Bodies in motion stay in motion. So if we're sitting at computers for long periods of time, we're playing video games, we're looking down at our iPhones, we're driving for long periods of time, all of these things that generate immobility in the joints and the spine are what recreate the symptoms that bring you to the chiropractic office in pain in the first place. Or again, if we drop out of care and stop doing the things that got us well in the first place.
So well said. Guys, remember this forever. The price you pay to win is always less than the price you pay to lose, especially with your health. Another way to think of it is the price you pay to neglect and lose with your health is going to be far greater than the price you pay to maintain and win with your health.
Absolutely. And just in closing, no one ever regretted being proactive. Think about it that way.
100%. Thank you guys so much for watching. This is Dr. Brandon Buttry, Dr. Cody Elledge, of course. Hopefully someone, if one person out there got value out of this video, then it will have been worth it. And that could change could change that person's life. It could potentially even save someone's life out there. So thank you guys so much for watching, and we'll see you on the next video.
Thank you.